Thank you so much to Agi for inviting me to be here today. I'm really looking forward to speaking with you all. I think this is a relatively ambitious title for a talk in terms of optimizing wellness, addressing psychological challenges of pancreatic cancer, but I hope that the talk lives up to its name through my coverage of these three distinct topics. So first, acknowledging and articulating some of the challenges faced by individuals with pancreatic cancer and their families, as well as speaking to opportunities for both psychological and spiritual growth, outlining the role of psychologists and social workers within the Agi Hirshberg Center for Pancreatic Disease, and finally sharing information about supportive resources that we offer through the Mann Center and other supportive resources that are offered throughout the greater Los Angeles area. And I hope that some of these will be new and different for you. So I'm a clinical psychologist, and I'm here representing the Mann Center. We were founded over 20 years ago now by our director, Dr. Ann Coscarelli, and the Mann family. And the goal of the center is really to enhance the physical, psychological, and spiritual well-being of people touched by cancer, both patients and their families and loved ones. We're a multidisciplinary team. We're made up of psychologists, social workers, chaplains, integrative nutrition specialists. We have a range of group facilitators, including art therapists, acupressure massage therapists, and a grandmaster qigong instructor. The majority of our services, including individual counseling and group support, are offered at no cost to patients. We run on donations. And we're housed in the 200 medical building on the 5th floor in a suite that's really designed to be a sanctuary, a calm space, more tranquil than a lot of the very busy clinics that are around us. I'm going to circle back to talk about some of the specific resources that we have to offer and how patients, and family members can make best use of those resources. But first, I want to talk a little bit. I'm going to introduce two laws that our director has. Again, that's Ann Coscarelli. She states this first law: for every physical effect, there is an equal reactive psychological or spiritual effect. And we acknowledge that cancer not only affects the body, but it also affects the mind, the soul, and one's emotional well-being. Integrative oncology means being committed to treating the whole person and not just the disease. Now, I know I don't need to tell this audience about how pancreatic cancer affects individuals and family members. Most of you here today have lived it, have experienced it yourselves. But I think it is helpful to name and articulate both the challenges and the opportunities that come with living with this disease. Now, this first slide, It's a tough one. It's acknowledging that disease and the disease itself and treatments can be highly distressing, that there's a high amount of associated anxiety and worry for many patients and family members. This can be related to treatment. This can be related to fears of progression, recurrence. For many, a diagnosis of pancreatic cancer challenges one's existence, what one understands to be their purpose and priorities in life. And we acknowledge that the whole family receives the diagnosis, not just the individual. These are some of the experiences that I see in my office and in the clinics every day, and that I work incredibly hard to try and address and alleviate. I'm going to present this next slide more as exploratory hypothesis than as fact, but in terms of understanding the link between depressive symptoms and pancreatic cancer. We know that there are high rates of depressive symptoms among those diagnosed with pancreatic cancer, certainly higher than in the general public, but also higher than within other types of cancers. And we might assume that depressive symptoms are a result of the diagnosis, but there's some interesting evidence to suggest that depressive symptoms, and these can be sadness, irritability, reduced motivation, fatigue, difficulty concentrating or making decisions, that these symptoms can actually predate a diagnosis of pancreatic cancer. And again, this is kind of in exploratory stages, but some ideas are that these symptoms are possibly a result of some of the biological changes that are actually occurring in the body when cancer is present. Some findings point to changes in the immune system, including increase in pro-inflammatory cytokines as potential biological pathways for pancreatic cancer to impact mood. And again, this is indicating that some mood changes may occur even before the cancer is diagnosed or detected. And as we can imagine, that these mood changes may in fact be compounded by the stress of receiving a diagnosis. This next slide is a little bit more hopeful because as much as I see the difficult emotional experiences of pancreatic cancer, I also see patients and family members identify with these experiences. None of these are shoulds. I think there's, there are a number of harmful messages out there around, the benefits of just thinking positively. And so none of these are things that we are prescribing, but again, my job, the job of my colleagues, is to help address, ameliorate, provide support around the difficult experiences, and guide people towards many of these outcomes. Clear, kinder communication with family members, a sense of having many skillful coping strategies, a space to explore shifting priorities. And I believe that all of these outcomes are possible with support, with expert guidance, with us devoting the time to really listen thoughtfully to the needs and priorities of the patient and his or her loved ones. Dr. Coscarelli's second law is that, again, cancer affects the mind, the body, the soul, and our emotions, and integrative oncology means being committed to treating the whole person and not just the disease. Given the challenges and the opportunities, what role do we as psychologists, chaplains, and social workers have to play in providing care? I think we can be involved in problem solving, whether that's around financial issues, issues of transportation, communication. I think we can help promote coping. Many of us are trained in evidence-based strategies for people who are dealing with anxious thoughts, depressive symptoms, fear of recurrence, or fear of disease progression. I think we can help address some of the side effects of medication, and those might include mood changes, sleep disruption, techniques to help manage pain. We can assist all family members. A lot of the work we do is providing consultation about how to talk about cancer with young children, perhaps. We can provide support to those who may be caregivers. We can explore questions of meanings, priorities, and we can also walk families through the process of developing advanced care directives or talking about goals for end-of-life care. This slide really covers our scope of practice. Now, what does that look like within the UCLA Agi Hirshberg Center for Pancreatic Disease? Patients and family members have always been encouraged to utilize the available resources at the Mann Center. We have excellent relationships with many physicians, nurses, and other staff who frequently refer patients to us or provide information about our services. What we've really strengthened is our presence in the pancreatic clinic itself, where we serve as part of this multidisciplinary team that is serving the whole patient. Our goals are to meet with each patient and family to assess their current needs, to provide support and information, to facilitate referrals, and that might be to our integrative nutrition specialist, to a psychiatrist, to one of our many wellness or support groups, to individual counseling, and to communicate with the medical team. So just to provide a little quick example of that last one, I worked with a lovely woman who was really, really disappointed that she wasn't able to attend her niece's wedding, which was taking place on the other side of the country. She saw this as a wonderful opportunity to see family members, to do something outside of her treatment and care here. But she said, with my treatment schedule, it's not going to be possible. I'm not going to be able to attend the wedding, and understandably, she was finding that quite upsetting. And I asked her, did you bring this up with your medical team? Did you ask, is there any way we might be able to shift around your treatment schedule to allow you to attend? She felt physically well enough to make the trip. And she said, given everything else, given the rest of the care that I'm receiving, the relatively short time that I have to speak with physicians, it doesn't seem important enough to bring up. And I said, okay, well, if I have the chance, would it be okay with you if I mention this? And she said, sure, if you have the time, please go ahead and mention it. I brought it up with her medical team, and they said, That would be fine. We can make a couple adjustments. We can change, delay treatment just by a couple days. That would be perfectly fine. She came back from that trip and was so energized by seeing her family, by making this trip. She said, for weeks after that, I just felt lighter. I felt more energetic. I felt more hopeful. And so just a simple example of the role that we can play in terms of enhancing communication between patients and their medical team. I also want to give another example because I think talking about individuals and their situations is oftentimes a lot more illustrative than talking about our work in general. I've changed some of the details of this individual, including his name, to protect his privacy, but I want to share with you the case of Mark. He is a 59-year-old teacher and father of two who I met with in the pancreatic clinic. When I spoke with him, he mentioned several physical conditions that he was dealing with, difficulty sleeping at night, feeling very fatigued during the day. He mentioned several sources of stress, including financial stress, the cost of his care, the fact that he was needing to take time off of work. He had issues with transportation. His wife was taking him to many of his appointments, but she also was working and had a demanding schedule. And he had some legal questions about his employment status, other legal issues. He expressed sadness and frequent worry. A lot of his worry was related to his children, what he should be telling them about his disease, about his treatment, how he should have conversations with his young kids. He also had nutritional concerns post-surgery. He was wondering what he should eat to be helping with recovery, whether there were specific foods he should be avoiding. In terms of his spirituality, he expressed a sense of wanting to pray, of wanting to connect to his spiritual beliefs, but having difficulty doing that since diagnosis. And I think his entire identity was really being challenged by this diagnosis and treatment. His identity as a husband, as a father, as a provider, as a protector, that in ways his treatment and diagnosis was eroding some of his sense of who he was as an individual. Some of the support that we were able to offer, we helped connect him to the American Cancer Society's volunteer program that helps with transportation to and from medical appointments. We were able to provide a referral to the Cancer Legal Resource Center so that he could speak with an attorney and get some of his legal questions addressed. We helped connect him to different financial resources, and we provided him with individual counseling to help manage his anxiety, to offer a space to process his experience. We met with both Mark and his wife to discuss how to talk about his cancer with his children in ways that were developmentally and age appropriate for each of them. He ended up participating in a couple of our support groups, the Mindfulness Meditation Support Group, which is an incredibly welcoming, connective group of individuals. And to help address fatigue, he had been a former runner, was no longer able to participate in that, but he found Qigong to be an excellent, low-impact source of physical activity that really helped address some of those fatigue concerns. In terms of spiritual care, he attended a session of our Circle of Reflection group, which is run by our chaplain. He also attended a 90-minute workshop on strategies to improve sleep. And he met with our integrative nutritionist specialist to talk about his dietary needs, specific whole food and supplements to help promote his recovery and general physical health. So you can see, obviously, I picked an example of an individual who was really excited and eager to take advantage of many of our resources, and oftentimes individuals might choose just one or two of our resources that could be helpful. But I think that these services really helped this individual, continues to help this individual through his treatment process. To spend a little time just outlining the resources that we have available, we do offer individual counseling. Again, that is at no cost to the patient or their family directly. We focus a lot on coping strategies that can help foster personal strengths, reduce the negative impact of cancer. A lot of us, again, are trained in evidence-based strategies to address mood and anxiety concerns specifically. Our spiritual care team consists of a chaplain and chaplaincy intern who are both trained specifically in oncology. They do individual sessions as well as facilitate the monthly Circle of Reflection group. I think for many people, talking with our chaplain can be a great way to explore some deeper questions related to purpose, meaning, and that can be useful regardless of faith identity or whether someone identifies as being spiritual. We have a huge range of weekly support groups. These are just some of the many offerings, but mindfulness meditation, guided imagery, support group for individuals with metastatic cancer, Qigong, a group for husbands or partners of women with cancer, and a bereavement group for spouses and partners that's offered 2 times per month. We host monthly lectures, which are open to the public. They consist of leading professionals sharing up-to-date information about treatment and managing different aspects of care. They're held Tuesday evenings from 7 to 9 p.m. in the B-level auditorium in the Ronald Reagan building. We have our brochures that list all of these talks. I certainly wanted to highlight the talk in July 12th that will be given by Dr. Donahue, Dr. Wainberg, focusing on pancreatic cancer. Almost all of our lectures, the Insight series, are videotaped, and they're available on our website. The archives, I think, serve as an excellent resource for a range of topics. So you could go to our website, you could search for nutrition, for example, and all of the archived lectures are available there. One, I think, I'll leave it at that. We also like to acknowledge that we are not the only show in town. In terms of our resources, we often provide referrals to other and connect people to other resources in town. Certainly, most noticeably the Hirschberg Foundation, in addition to the Cancer Support Community, the Mindfulness Awareness Research Center, UCLA Center for East-West Medicine, WeSpark, and the American Cancer Society. So we're really collaborative. We often make referrals to other centers and take their referrals as well. I want to offer just a little bit of information about coping in general. I know that I may never get the chance to see many of you in clinic or offices. You might have other sources of support that you've already been using, but I do want to leave you with some general thoughts about promoting effective coping. And I like this definition of coping as strategies that can be cognitive, behavioral, or social in nature that patients and families use to bring about relief in relation to a perceived threat or demand. So what do we know about coping? We all have our unique coping styles. Not every strategy works for every person. We can recognize that some coping strategies are healthier and more helpful than others, and coping strategies that you may have relied on in the past to deal with other issues, work issues, relational issues, they may or may not apply to the context of pancreatic cancer. In terms of unhelpful coping strategies, we know that denying or avoiding crisis is not helpful. Then engaging or all or nothing thinking, having a sense of waiting for test results and feeling like either it's going to be completely positive, the result that you hope for, or that all hope is going to be lost, but recognizing that there are really many shades of gray and being able to acknowledge those. Avoiding information, repressing negative information, remaining isolated or passive, using food or substances to numb or avoid feelings, and focusing on what is lost without balancing what is gained or things that are going well. Coping strategies that we know can be really helpful. Taking one day at a time, focusing on the real issues at hand, being information and resource seeking, working to manage stress levels. We know that stress can really interfere with healing, with sleep, with decision making. So taking proactive steps to address your stress levels generally. Accepting feelings and finding time to identify, to acknowledge, to express them. I sometimes use the metaphor of a soda can, and we're walking around all day, and that soda can is getting jostled, things are getting, stirred up in there, and we need to take time throughout the day to release some of that pressure, to express, to get out what it is that we're feeling, that we're experiencing. The value of using social support, of reaching out for help, of communicating with your healthcare team about your priorities, if there are things that you're confused about, have questions about. Utilizing spiritual resources if they are a source of comfort to you. Identifying the needs of many of different family members, recognizing that, again, everyone has different needs, different reactions. And trying to maintain realistic hope. Recognizing that hope is sometimes a shifting, moving target as well. I think anyone who receives a diagnosis, any family who receives a diagnosis, the original hope is for full cure, full recovery. And when that is not possible, hope might shift into something else. Maybe it shifts into years of a good life, of being able to participate fully in the things that matter to you. Maybe over time that shifts to being able to participate in a specific event, a wedding, the birth of a grandchild, a graduation. Hope can also shift into relating to death, wanting a dignified death, having time to express and communicate things that are important with family members, with friends, with loved ones. So hope can shift and change, but I always believe that there is something worth hoping for, and that's worth recognizing. Our director of the Sims Mann Center, Ann Coscarelli, communicates on her website 3 important wishes. She writes, "I have 3 wishes. The first is that cancer as a disease will be cured during my lifetime. The second is that it will be prevented. And while these may not be possible, my third wish is that all individuals with cancer received optimal, comprehensive medical and psychosocial care that allows individuals to maximize their health and wellness." We believe that this third wish is obtainable now and here, certainly at UCLA through the Agi Hirshberg Center for Pancreatic Disease. And we're committed to paving the way so that this is the standard of care for anyone facing a diagnosis of pancreatic cancer. Thank you.